Do you know that women don't catch UTIs? Are you surprised? Oh yes, because UTIs catch us. This is UTI. UTI, it's urinary tract infection. Guess what, lady? It's not just you that suffers with urinary tract infections. It is biology. So thank Mr. Anatomy for that. Let's just say our anatomy as women was clearly designed without reading instruction manual. Everyone, I remain Sinat, your favorite informative urology nurse practitioner. I am not here today to talk to you about prostate health because I have an important message for the women. Did you notice I'm wearing a different color of scrub? So when you see me wear purple scrub, I will be discussing issues concerning women's urological health.
Ain't girls me a clock it purr.
So urinary tract infections, which is also known as UTIs. Women get UTIs more often because bacteria have a shorter distance to travel. And guess what? Knowledge is power. So today, we will be breaking the stigma and boosting the awareness because your health as a woman deserves the spotlight. It's quite so unfortunate and frustrating reality for many men today. And you are imagining, am I the only one? No. Statistics have shown that women are significantly more likely to experience UTIs more than men. So I'll be breaking down why this disparity exists in this video. And the number one thing I'll be talking about is the anatomy of the female body. That is how the female body was made. The short distance syndrome. You surprised? What is the short distance syndrome? So the primary reason is because of what we call geometry. The urethra in men is typically about 4 times longer than the urethra in women. So in women, the size of the urethra, that is the pipe that carries wee from the bladder, is about 3 to 4 cm compared to men who have a longer urethra, which is about 15 to 20 centimeters. So the proximity between the urethra of female and the anus, that is the place where the poo comes out, the feces comes out of the body, is closer for female compared to the male. And that is why women are more prone to urinary tract infections. So the anus is a natural reservoir for what we call E. coli and other bacteria that could easily transmit into the urethra and cause recurrent urinary tract infections for women. So because this tube is shorter, bacteria have a shorter time to commit and to reach the bladder. The bladder is the balloon that holds the urine in the body. And the infection is easily transmitted because of the short distance between the urethra and the anus. Factor that could contribute to this is what we call hormonal shifts or menopause. So estrogen, it's the hormone that helps maintain good bacteria. That is the normal vaginal flora. Your vagina is not supposed to smell like a strawberry. No, the vagina has its own healthy bacteria, which is called lactobacillus. And this is a normal vaginal flora. This bacteria keeps the pH of the vagina acidic, which prevents harmful bacteria from moving towards the urethra. So as women grow older, the estrogen levels in women naturally decreases. And because of these shifts and reduction in estrogen level, it affects the vaginal health and puts women at UTI risk. That's why you see a lot of older and postmenopausal women today suffering from recurrent urinary tract infections, that is UTI. Don't get me wrong, younger women also have hormonal shifts, which could be triggered by so many factors, such as stress. And because of stress, we have what we call the cortisol hormone in the body. The cortisol hormone in the body is produced during stress, and this reduces the production of what we call the gonadotropin hormone, which is the hormone that triggers the production of estrogen in women. The other couple of factors that could cause the estrogen level in younger women to reduce, which includes some medications, weight, ovarian insufficiency, and smoking. Number 3 thing I'm going to be talking about today that could trigger recurrent urinary tract infections in a woman is sexual intercourse. Yes, you heard me right. The mechanical movement during this is one of the most common triggers for urinary tract infections in women. The physical nature of sex can push bacteria from the surrounding skin into the urethra, thereby increasing the risk of having urinary tract infections. However, this is not to say you shouldn't have sexual intercourse with your husband or with your partner, but I'm going to be giving you some prevention tips after I'm done discussing about the causes. First cause I'll be talking about today is contraception. There are some types of birth control, specifically spermicide, diaphragms, that could disrupt the natural bacterial balance or physically irritate the urethra area and making it easy for an infection to take place there. Another factor that is common that causes urinary tract infection in women is childbirth. Childbirth weakens the pelvic floor. So during childbirth, the physical passage of the baby and prolonged pushing stretches, strains the muscle supporting the bladder. A weakened pelvic floor contributes to recurrent urinary tract infections, primarily preventing the bladder from fully emptying. It's just as if you've got stagnant water in a lake or in a pool. You imagine how bacteria, how mosquitoes are going to be breeding in that lake. That's what happens when you don't fully empty your bladder. So leaving stagnant urine behind to act as a breeding ground for bacteria. Genetics is also an important factor that can contribute to you having recurrent UTI as a woman. Some women are simply born to be more susceptible to urinary tract infection. Research suggests that certain people have specific type of receptors on their bladder cells that can act like Velcro, making it easier for the bacteria to latch on and stay and breathe in the bladder. And one last sneaky reason why UTIs return for you as a lady, I will attribute this to what we call the biofilm and the antibiotic resistance. What is biofilm? Biofilm is a slimy protective layer built inside the bladder lining. The bacteria act like squatters, hiding in your bladder wall under a biofilm blanket and refusing to leave, even when the antibiotics politely ask them to vacate the room. So antibiotics can clear the bacteria in the urine, but the ones hiding in the biofilm stay asleep and untouched. So continuous use of antibiotics to treat this type of infection can cause antibiotics resistance. My ladies, gather around. If UTIs keep making a comeback in your life, don't worry. I've got few tips to shut down that nonsense. Even though biology is stacked against us as women, these habits can help tilt the scale for you and prevent recurrent urinary tract infections that you are having. The first thing I'm going to be talking about today is hydration and diet. Water physically flushes out bacteria before they settle, and less of refined carbohydrate diet also helps in preventing recurrent urinary tract infections. You are encouraged to take more of green protein, good fat diet, and the rainbow vegetables, that is, make your plate more colorful. The second prevention tip I would be giving you today as a lady to prevent you from having recurrent urinary tract infection is postcoital voiding. So peeing soon after sex helps to flush out any bacteria that may have been introduced near the urethra. This doesn't sterilize anything, but it just reduces the chance that bacteria linger long enough to cause urinary tract infection. The third thing that I'll be talking about today that could help you prevent recurrent urinary tract infection is wiping from front to back. What does that mean? So if you are using a toilet, it is advisable as a lady to wipe from the front to the back, because this prevents E. coli, that is a bacteria that is found in the feces, from transmitting from your anus towards the urethral opening, which could actually spread into your bladder and cause infection for you. So it is advisable for you to clean from front to the back while cleaning yourself up in the toilet as a lady, to prevent you from having recurrent urinary tract infections. Pelvic floor exercise, I would always say that this helps to strengthen weak pelvic floors that could have been weakened through childbirth. We have a graphic image that is quite explanatory and describe how to go about doing pelvic floor exercise on our TikTok and Instagram page. So you can go to our TikTok or Instagram page to have a look at that image. It gives you an explicit explanation of how to go about doing pelvic floor exercises to help you strengthen your pelvic floor muscles that could have been damaged while having childbirth. You know that melanin rich skin, just like mine, naturally filters ultraviolet rays like built-in SPF. But however, this could put us as black skinned people at risk of having vitamin D deficiency. So it's amazing. Melanin skin acts as protection. It also means your body needs more sun exposure to make vitamin D. Here's the twist. Vitamin D plays a key role in urinary tract immunity. It helps in activating bladder lining receptors, calming inflammation, and helping to stop the growth of E. coli, that is the bad bacteria, from sticking to your bladder. So your vitamin D outside is knocking the door, saying, hello, can I come in? So we can fight E. coli together. However, you are having a reduced level of vitamin D. So it is advisable, if you are a lady and you are having a recurrent urinary tract infection, you may want to check your vitamin D level to see if you are having this recurrent urinary tract infections because you have reduced level of vitamin D, and to see if you could require some supplements to help you increase this level of vitamin D in your body. The last prevention tip I would be giving you today is the use of vitamins. Creams like estrogen vaginal creams, vaginal pastries, and some other over-the-counter medications that can help you maintain your urinary tract health as a woman. And there are some probiotics that contains vitamins like cranberry, vitamin D, vitamin C, and zinc. All these vitamins are very good to help maintain a healthy balance system both with your vagina and with your urethra. And cranberry juice is very good for your urethra health. My last note for you today as a lady is, in case anyone ever asks you, what do you bring to the table? Forward this video to them to show a proof to say that our plumbing works were engineered skipping a few drafts, and this has contributed a lot to our health. Women are at risk of having urinary tract infections because of childbirth. Women are at risk of having urinary tract infections because of sex. Women are at risk of having urinary tract infections because of birth controls. Women are at risk of having urinary tract infections because of hormonal changes and hormonal shifts. So we have got a lot happening in our entire body as women. This should be appreciated. I remain Sinat, your favorite urology nurse practitioner. So like, follow, subscribe, and share with every woman in your corner today. Bye. See you on our next video.